Hello, everyone, and welcome to the March 2022 practice update video. My name is Jen Bolster. I am a paramedic practice leader in the Vancouver coastal region. So starting with community paramedicine, with the expansion of community paramedic practice scope to allow for subcutaneous butterfly catheterization to support patients in the community, a clinical practice guideline has been developed to support CPs providing subcutaneous rehydration therapy in the community. CPs may begin to utilize this CPG once they have completed the requisite training following a request from a healthcare partner. For clinical pathways, beginning with Fraser, to consolidate several separate guidelines regarding stroke clinical pathways in the Fraser region, the BCEHS handbook has been updated to provide greater clarity regarding appropriate destinations for patients suspected of stroke. In preparation for the expanded rollout of LifePak 15s in the Fraser Valley, a STEMI clinical pathway has been created to support primary care paramedics trained and equipped with LP15s transporting patients with STEMI to the most appropriate care. For more information on this pathway, please refer to the BCEHS handbook under clinical pathways. For interior, to support paramedics in the Kamloops region, providing greater options for care for patients with palliative care needs, BCEHS and Interior Health have collaborated on an alternative destination clinical pathway, which would allow paramedics to refer patients to hospice rather than transport to the emergency department. This is for cases where a patient's care needs cannot be met on scene. The clinical pathway will provide the following possible outcomes: care in the home with same-day follow-up by the palliative care team, conveyance to a community hospice bed, or conveyance to the emergency department if no other option can be found. Paramedics working in the Kamloops region should contact the palliative care coordinator when attending to a patient with palliative care needs if the most responsible clinician is not available to discuss care planning options. For the North, on February 14th, Prince George Urgent Primary Care Centers began accepting referrals from BCEHS paramedics for patients who meet the generic UPCC referral criteria and presented with minor wounds, minor allergy, and minor burns. Additionally, the Prince George UPCC is now receiving referrals from secondary triage paramedics in the Vancouver Dispatch Center. Paramedics working in the Prince George area are asked to please keep this option in mind when attending to patients in the community. UPCCs are an important option for patient care, assisting in getting patients connected with the right care the first time. This approach also assists with reducing emergency department overcrowding, improving flow for critical patients. Regarding informed consent for patients declining conveyance to hospital, Clinical and Medical Programs has worked with a number of health authority partners to develop A-STAR clinical pathways for patients with low acuity illness or injuries unlikely to require diagnostic testing, imaging, or management in the emergency department setting. Paramedics enrolling patients into these clinical pathways should have conversations with patients regarding this low likelihood of intervention in the ED and engage in informed, shared decision-making conversations with patients. In cases of patients declining conveyance to hospital, this should include a meaningful discussion of the benefits and risks of conveyance or non-conveyance. Paramedics should avoid using phrases such as "the hospital won't do anything for you" during consent discussions related to conveyance. Given the power dynamic which exists between provider and patient, language such as this may be construed as pressure to decline conveyance without reasonable opportunity to reflect on their decision. Paramedics should provide information about the reasonably expected risks of non-conveyance and benefits of conveyance, and acknowledge the limitations of the risk-benefit analysis given the limited diagnostic capacity of paramedic practice. If additional information is required to support these sometimes challenging discussions, Clinical remains available 24/7 to paramedics. For secondary triage, as previously communicated, a group of primary care paramedics have stepped into Vancouver Dispatch to support secondary triage initiatives, providing coverage in pairs between 6 a.m. till 2 p.m. These initiatives are critical to ensuring patients receive the right care. And since the introduction of these clinicians, 616 patients in 1 month, or an average of 21 patients per day, have received an enhanced clinical assessment prior to ambulance dispatch. Of these 616 patients, 47% were connected with more appropriate healthcare options to meet their needs, saving approximately 387 paramedic hours in the process. Work is ongoing to support these clinicians, providing enhanced assessment to even more patients who may be better served by alternative services in the community as opposed to immediate ambulance dispatch. And finally, we would like to welcome and recognize the large number of new clinical staff within BCEHS. With the addition of new staff, clinical and medical programs would like to highlight the PHSA Stop the Line policy. Although the Stop the Line policy focuses on preventing events that have the potential to seriously harm a patient, all personnel, including BCEHS staff, are expected to use the policy to stop any practice that has the potential to be harmful, regardless of the degree and likelihood of physical, mental, emotional, or psychosocial injury. Any person who observes or becomes aware of any situation that may cause imminent patient harm has the authority and responsibility to speak up and request the process be stopped in order to clarify the patient safety situation, regardless of seniority or role gradients. Lastly, we would like to thank staff for the consistent daily commitment and dedication to providing quality patient care to the communities that you serve. As always, if you have any questions or comments regarding clinical practice, please email us at clinicalpractice@bcehs.ca. Bye for now.